Okay, so now we are in part three and the final part, I'm sure we're all happy to hear, of the infection control lecture. So we talked about these airborne precautions and N95 masks. Um, this is just a little more detail on airborne precautions. Fit tested N95. Remember, I mentioned that those masks are specifically designed in various sizes so that you're able to achieve a very nice seal to really have that comfort level that you're protected. These are only going to be used in some situations. They're not as universal as some of the other types of masks. It's when we know that we're going to be coming in contact with some of these pathogens. So next we go to neutropenic precautions. If you remember from your pathophys, or maybe you're learning it right now, neutrophils are one of the infection-fighting white blood cells. And so for many different reasons, patients will be at risk with low levels of white blood cells. It could be related to a specific diagnosis that they're facing, uh, or medications that they're taking that lower these levels. And so, in general, we're just extra aware with hand washing masks. They're typically in a private room. Many precautions are taken to try and protect these patients. Therapy is often performed there, and patients wear masks. So, in general, as we've talked about in these inpatient settings, often we will be treating patients who are sicker and immunocompromised and just at greater risk for infection. And so these infection control efforts are even that much more important in these settings. So we talked about cough etiquette. You've heard the whole idea of kind of coughing into the bend of your elbow. Of course, just covering your nose and mouth whenever a cough or sneeze is happening, and disposing of used tissues, immediate hand hygiene, wearing a mask when you can, social distancing. It's interesting because teaching this material every year, I feel that now it's just much more common knowledge throughout the general public. The whole idea of social distancing, I don't think we'd ever really heard those phrases until uh, in this year. So here's a slide, or I mean, a poster from the CDC that talks about cough etiquette, quite obvious. And I always like to say that in general, the foundations courses are a lot of common sense, a lot of intuition. Uh, and just a comment that I'll make, I think I've made this before. Many of you last term were very much at home with the outpatient orthopedic setting and all the different types of material we covered there. While others of you, and some I'm maybe not even aware of, but I've become aware of many of the students in our class have had significant experience working before PT school in inpatient settings. And so now I guess will be your time to shine, or your time to have that extra comfort level with a lot of the material that we're going to cover. And so, as we said last term in Foundations 1, if this is a strength of yours, reach out and help your classmates if they have not spent much time in these inpatient settings. So obviously, with any kind of equipment that we've used, you guys have already learned this as far as wiping down and cleaning uh, table surfaces, any kind of equipment, very important in this inpatient setting in the infection control perspective. Um, One very important point to make is that in these hospitals, skilled nursing facilities, subacute settings, inpatient rehab settings, even long-term care facilities, floors are often great's the wrong word, a terrible source of infection. And so if you could see through a magic instrument all of the microorganisms on hospital floors, you would never kneel or sit on floors. And so we'll talk about this further in the term, but as we get to practical exams in this Foundations 2 course, we will be working with case scenarios that are supposed to be in an inpatient type setting. It's a challenge every year because it will be in one of the exam rooms, 1, 2, or 3, and they are carpeted exam rooms that you often study in, and they don't look or feel much like a hospital room, but we're trying to have it be a simulated hospital room, and so we've tried to do different things over the years to put up signs and call it Franklin Pierce University Hospital, for example, when we're doing our uh, our practical exams, but we want to really drive that point home. As soon as you are on a full-time clinical rotation in one of these settings, I think it will just become quite apparent to you that you don't want to have anything to do with the floors. So, for example, one area that we'll cover later in the term is where we will be prescribing assistive devices. So we will be perhaps fitting a front-wheeled walker for our patient. And so we need to raise the height of the front-wheeled walker. So all four of those legs need to be lengthened. And it's real easy to flip the walker upside down, and now we just put the handles where the patient's hands are going to go onto this uh, disease-filled floor. I should say microorganism-filled floor. And so the preferred method will be to turn that walker upside down and basically kind of rest it on our legs or our lap, if you will, while we're standing, and make the adjustments that way. But in addition to the floors, anything that may come in contact with the patient, a gait belt, a stethoscope, towels, bed sheets, our shoes, all of these are surfaces that we need to use extra caution in terms of infections. So we want to stay away from floors. We want to wipe down gait belts, stethoscopes, and so forth. And just we don't want to put our shoes on the patient's bed or table because our shoes have been on those floors that have so many uh, microorganisms on them. So that we'll talk about that many additional times, but will definitely be an area of focus. So obviously, whenever we have any contact with patients, we want to wash our hands. We want everything we've just talked about. Remove our personal protective equipment with the contaminated sides turning in on themselves. We want to if we have to change any bed sheets or anything, we're trying to keep all of those surfaces that may have had contact with the patient and keep those away from us and kind of turn them in on themselves and then clean all of the surfaces when we're done. Um, so typically at this stage in an in-person lecture, we would have all of you think about on your own and then with your partner next to you and then maybe in a group some of these questions. So I'll give you some time to think about these things and come up with what you think would be where some of these what types of precautions should be used. And so we will have a synchronous, meaning we'll all be together, even though it's virtual, we'll all be together talking on Monday at 10 a.m. And so we can answer some of those questions at that time, and that will be a chance to kind of somewhat be together in class, if you will. And so this will be handled a little bit differently from how we normally would do that. Uh, and we will have a lab at some point where we can have you actually have the experience of donning and doffing personal protective equipment. Not sure exactly when that lab will happen, but we will plan to do that at some point in the future. So this concludes our infection control lecture. Make sure that you read the other materials that are on this module in Canvas. As I mentioned, the CDC article about C. diff is a very important one, and there are others. So make sure that you've read through all those materials. Now, after having read the chapter in our mobility and context book and having listened to and studied this lecture, you should be ready to take that online infection control quiz or exam. I think we call it a quiz. And I think I stated in an email, that will be necessary. Your evidence that you've taken that and passed it will be necessary for you to go out on your clinical rotations. So we'll talk more about that in the future. Thanks very much. We'll talk to you soon.